One of the most frustrating moments for any patient is seeing that you've been taking your blood pressure medication exactly as prescribed, your numbers were stable for months, and suddenly, they start creeping back up. You haven't changed your dose, but your body seems to be ignoring the medicine. In the medical world, we call this resistant hypertension, and for many people, it feels like a losing battle. But here is the secret. Your medication hasn't failed. Something in your daily routine is likely neutralizing it. In this video, I'm going to reveal the 4 most common reasons why your BP meds stop working and the simple adjustments you can make to get your medication and your heart health back on track. Good day and welcome to Heart and Health. I'm Dr. Ed, a cardiologist. Blood pressure medications work through specific pathways. Some relax your blood vessels, others flush out excess salt, and some slow down your heart rate. However, your body is a dynamic chemical factory. If you introduce certain interfering agents, you can physically block the medication from doing its job or trigger a secondary system that forces your blood pressure up through a different back door. It's like trying to cool a house with the air conditioner running while all the windows are wide open and the oven is on high. We need to identify these open windows in your lifestyle that are working against your prescription. By addressing these 4 specific areas, you can often restore the effectiveness of your original dose. Disclaimer: please remember that the information shared in this video is for educational and awareness purposes only. Never stop taking your prescribed medication or change your dosage without strictly following the guidance of your healthcare provider. If your blood pressure is consistently high, seek medical attention immediately. Reason 1: the NSAID interference. The most frequent reason I see for medication failure is the use of nonsteroidal anti-inflammatory drugs, or NSAIDs. These are common over-the-counter pain relievers like ibuprofen, naproxen, and aspirin. If you are taking these regularly for back pain or headaches, you are likely neutralizing your blood pressure pills. NSAIDs work by inhibiting enzymes that reduce inflammation, but those same enzymes are responsible for keeping your blood vessels open and helping your kidneys flush out sodium. When you block them, your body retains water and your vessels constrict. This creates a tug-of-war where your BP med is trying to relax the system while the painkiller is forcing it to tighten. Your routine should be to switch to acetaminophen for minor pain, as it doesn't typically interfere with blood pressure pathways, or talk to your doctor about natural anti-inflammatories like turmeric. Reason 2: hidden sodium congestion. The second reason is what I call hidden sodium congestion. You might not be using the salt shaker, but if your diet has shifted toward more processed or restaurant-prepared foods, you are likely overwhelming your medication. Many blood pressure meds, especially diuretics and ACE inhibitors, work by managing the sodium-to-water ratio in your blood. If you flood your system with 4,000 or 5,000 milligrams of sodium a day, your medication simply cannot keep up with the fluid retention. This increases your total blood volume, making the pressure inside your pipes rise regardless of the medicine. Your routine should be to focus on the potassium to sodium ratio. Instead of just cutting salt, dramatically increase your intake of potassium-rich foods like spinach, avocados, and white beans. This signals your kidneys to bypass the sodium retention signal and helps your medication do its job more efficiently. Reason 3: the sleep apnea problem. The third reason your meds might seem ineffective is a hidden condition called obstructive sleep apnea. If you snore loudly or wake up feeling exhausted, you might be stopping breathing dozens of times a night. Every time you stop breathing, your brain panics and sends a massive surge of adrenaline through your system to wake you up. This adrenaline spike keeps your blood pressure sky high all night long, and that stress residue carries over into the next day. This is why many men have high morning readings even if they took their pill the night before. No amount of medication can fully overcome a nightly adrenaline storm. Your routine should be to get a formal sleep study if you have daytime sleepiness or loud snoring. Treating sleep apnea with a CPAP machine or dental appliance is often the secret key that makes previously resistant blood pressure finally drop into the healthy range. Reason 4: alcohol and vascular rebound. Finally, we must address alcohol consumption. While a single glass of wine might feel relaxing, chronic, or even weekend only, drinking triggers a vascular rebound. As the alcohol leaves your system, your sympathetic nervous system becomes hyperactive, causing your heart rate to increase and your vessels to tighten. This rebound effect can last for 24 to 48 hours, effectively blocking the vasodilating effects of your medication. If you drink regularly, your liver also prioritizes processing the alcohol, which can alter how your body metabolizes your BP medication, leading to inconsistent levels of the drug in your bloodstream. Your routine should be to implement dry windows, at least 4 to 5 consecutive days a week without alcohol, to allow your vascular system to stabilize and your medication to maintain a consistent therapeutic level. In summary, if your blood pressure meds have stopped working, look for these 4 culprits. 1. NSAID use. 2. Hidden sodium overwhelming your system. 3. Undiagnosed sleep apnea. And 4. The alcohol rebound effect. Addressing these isn't just about making your pills work better. It's about fixing the underlying stress on your heart. If you found this checklist helpful, please subscribe to Heart and Health. We are here to help you troubleshoot your vascular health so you can stay off higher doses and keep your heart strong. I'd love to hear from you. Have you noticed your numbers spike after taking certain painkillers or after a salty meal? Let me know in the comments below. Thank you so much for watching, and as always, take care of your heart.